Hey guys, I'm Jackie and welcome back to JackieNaturals. I hope you all are having an awesome day. So if you haven't noticed by the title of this video, I am super excited because I went to Vita Dental today and saw Dr. A for part 2 of my Invisalign journey. Today I did see the Invisalign simulator and guys, it was super cool. It was 3D and you know I got some raw footage for you, so I will be sharing that. So make sure you stay tuned. Also, I was able to get all the information about the process, how long it's going to take, and I recorded it all for you guys. So stay tuned because I will be inserting that. But spoiler alert, he did confirm we're looking at 6 months or less. So I am so excited. I can't wait for you guys to see the results from the simulator. It was super cool. So I will insert that here so you guys can check it out. Also, I did want to mention Dr. A was gracious enough to give me a 20% off discount code to share with you guys. It is Vita420. Again, that will save you 20%. So definitely check him out. I'll leave all the deets below. But check out the raw footage from the 3D Invisalign simulator and the aftercare that he provided to me. Dr. A1, highly recommend him, guys.
And we're going to see your 3D before and after now. That's your upper and lower arch. So let's isolate the upper arch so we can see a better view from it. So you can see that your laterals are retroclined, meaning like behind your centrals. They're supposed to be aligned with all of this. So then all these little bumps that you see here, they're called attachments.
Okay.
So here we place the same material that is used for cavities. So we put in here resin-based composite. Obviously, it's going to be the same color as your teeth.
Okay.
So it's not going to be as noticeable.
Okay.
Obviously, that helps the Invisalign rotations be quicker. And don't worry about that. At the end, all of this will be removed and polished like nothing had happened in there.
Okay.
Okay, so far so good. So now let me show you the good stuff. All right, so now the best part. So when I press play here, you're gonna see by aligners how your teeth are gonna shift back to where they're supposed to be.
Okay.
Okay, so you ready?
Yes, I'm ready.
Let's go.
Oh my gosh, that's so cool.
Isn't that cool? Okay, so 2 things that I need to let you know.
Okay.
So since you have mainly, your main problem is crowding.
Yes.
Meaning your arch doesn't have enough space for your teeth. So Invisalign is recommending, remember that I mentioned interproximal reduction where we do have to shave between your teeth? Well, they're recommend if you see all these 0.5s, they're recommending 0.5 millimeters. Again, that's really small.
Okay.
Yes, on the bottom, more than the top. Only on the top, they recommended here 0.3, which is not bad at all. Okay, so again, all of that will allow your teeth to go back to the position where they're supposed to be.
Gotcha.
Okay.
And that doesn't hurt when you have to shave it.
No, it doesn't hurt. So it's pretty much it. So they sent 10 aligners. I'll generate a schedule for you. I usually like to recommend 14 days between aligners. Okay. So it allows your bone to properly build around the root of your teeth, and you don't have any root resorption.
Okay.
Okay. Now the other point that I wanted to talk to you about was at the end. All right. So you got to see this. All right. Let me go before. Like if you see it here in the beginning, this is the before now.
Okay.
So now this looks pretty even. It looks even because of the position that it is, that it has caused wearing of the enamel on areas that is not supposed to.
Okay.
So now when you get completely aligned, you're going to see those areas stand out more, like here.
Oh, okay. Gotcha.
Let me zoom it in. All right, so you're going to see this area here, you've lost enamel because of your teeth were not in the right position.
Gotcha.
But when you get it back to the right position, this is going to become more visible. This is not a big deal. I could just recontour this area and make it all even.
Okay.
And the lateral here as well. It's another one that I noticed that you're going to end up like being more visible of the enamel wearing in this side. So if worst case scenario, I'll just round it off, polish it to make it look even. Okay. So again, this is all protocol, is very normal, very common,
Okay.
and you shouldn't have any complications. It's a pretty straightforward case, and you should enjoy it. Again, you have to wear the aligners 22 hours a day.
Okay.
The other 2 hours, you use it to eat or drink anything other than if you drink anything with colors like red wine, Coke, stuff like that, it may stain your aligners.
What about coffee with a straw?
You could, as long as you don't have any backflow when you remove the straw.
Okay.
As long as you don't keep any other coffee in the mouth,
okay,
you shouldn't have any issues.
Okay.
Worst case scenario, and you don't hear this from me, and this is off the record. You can leave it on the recording. I don't mind. Worst case scenario, if they do get a little yellow, you could put, I'm saying like one finger level of Clorox and 3 of water.
Oh wow! Okay.
All right. You didn't hear it from me. It's tricks that my patients have taught me. Okay.
Okay.
So then you put it in for about half an hour to 1 hour, more or less. Then you take it out. That should definitely help it. Okay.
Okay.
But then again, it's 14 days only that you're gonna have to wear that aligner.
Okay.
So then once you move to the other one, you get a brand new one.
Okay.
So it's not a big deal. Okay.
And the shavings, is that something that's done pretty quickly?
The shavings, yeah, it's pretty, I mean, again, we're only reducing 0.5 millimeters. It's a very small amount. I usually do it with a burr and a machine that every patient hates the sound.
Okay.
So, but it's actually painless. Okay. Worst case scenario, if you do experience minor sensitivity, we have topical anesthetic that we can always apply that in there.
Okay.
But again, it's a pretty straightforward case. You shouldn't have any complications.
And we'll do that with the next visit?
Yes.
Okay.
Yep.
That's exciting.
Yay!
Okay.
So pretty much, after you're done with the Invisalign, you'll wear a retainer for 3 months, the same way that you were gonna wear the aligners. So you're gonna wear it 22 hours a day. Okay. After 3 months, you're only gonna wear it to sleep. Okay. It serves 2 purposes. It will help you with grinding and clenching, and it will retain the position of your teeth. Now, if you by any chance you lose them for whatever reason, you need to run and get new ones. Okay. Why? Because your teeth will start shifting back. Wow. To that position. Fast. Yeah. Okay. It'll probably take a couple months till they start shifting back. Okay. But the second, let's say, if you spend a week without them and you put them back in, it's gonna be tight. You're gonna feel that your teeth were starting to shift back. Okay. Yeah. Gotcha. So always, make sure you keep them safe. Okay. Yeah. Yeah, other than that, it's pretty straightforward. All right, awesome. Sounds good. Oh my gosh. You can't tell me that 3D did not look absolutely amazing. Guys, stay tuned for part 3. That's when they'll be doing the shavings and I'll get a few of my trays. So we're really going to be getting into it. Definitely, if you know anyone looking, share this journey, share Dr. A. I highly recommend him. He is absolutely amazing. Thank you again to Dr. A. Don't forget, there is at 20% off using code VITA420. And make sure you like, comment, and subscribe so you can see and go along this journey with me, and I will see you all in my next one. Bye.